The topic of our today's discussion is peptic ulcers. So the contents are definition, etiology, pathogenesis, clinical presentation, diagnosis and pharmacotherapy. So first of all, the definition of ulcer. An ulcer is a sore, which means it's an open, painful wound. They can take many forms and can appear both on the inside and outside of the body. Injuries, diseases and infections can cause them. A peptic ulcer is a sore on the lining of stomach, small intestine or esophagus. A peptic ulcer in the stomach is called gastric ulcer. A duodenal ulcer is a peptic ulcer that develops in the first part of the small intestine, that is duodenum. Etiology means the causes of peptic ulcer. The most common causes of peptic ulcers are infection with the bacterium Helicobacter pylori, long-term use of NSAIDs such as ibuprofen and naproxen sodium, tumors that cause a hypersecretion of gastric acid like Zollinger-Ellison syndrome, and lifestyle factors such as smoking and tobacco use. Then the pathogenesis. So in our body we have the protective factors and aggressive factors. The protective factor includes the mucosa, bicarbonates, and the aggressive factor include gastric acid, H.pylori, NSAIDs, oxidative stress. In case of ulcer, there is an imbalance between the protective factors and aggressive factors. Then gastric ulcer formulated by H.pylori. Infection with H.pylori negatively influences several of the important defense mechanisms in the gastric barrier. However, the exact mechanism leading to development of pathological changes by H. pylori remain to be further investigated. H. pylori catalyzes urea hydrolysis with the formation of ammonium that neutralizes the surrounding gastric acid and protects itself from the strong acidity of the stomach. H. pylori then penetrates the mucous layer of the stomach, adheres the surface of gastric mucosal epithelial cells, proliferate and finally form the infectious focus. The gastric lesion is developed by destruction of mucosa, inflammation and mucosal cell death. Then there is the clinical presentations. The signs and symptoms of peptic ulcer are as follows. Epigastric pain. The pain tends to be worse at night and occurs 1 to 3 hours after meal. Nausea and vomiting, belching, significant weight loss, complications of hemorrhage in 1/3 patient, feeling of fullness and stool discoloration, also known as melena. Peptic ulcer symptoms. Mnemonic is FAB time. So F for fatigue or feeling fullness, A for abdominal pain or discomfort, B for belching or bloating, T for tender abdomen, I for ingestion, M for melena, and E for emesis, such as vomiting. Then diagnosis. So 3 types of diagnosis: laboratory test for H. pylori, endoscopy, and upper gastrointestinal series. In case of laboratory test, breath test. The laboratory test is done by using blood stool or breath test, and the breath test is the most accurate. Then the endoscopy by the using of endoscope, and upper gastrointestinal series by also called as barium swallow. X-ray technique. Pharmacotherapy. Triple therapy for eradication of H. pylori. It includes omeprazole 10 mg BID plus amoxicillin 1 gram BID plus clarithromycin 500 mg BID for 7 to 14 days. So this is all about the peptic ulcers. Any questions you can ask in comment box.